Hello, I am Dr. Anirudh Kulkarni. I'm an interventional neurologist associated with Apollo Hospital, Jayanagar. And today I want to give you a brief introduction to aneurysms. Aneurysms are basically bulges in the blood vessel that can happen for a variety of reasons. Most of the times they are found in people who have high blood pressure. They may have other atherosclerotic risk factors, that is the same risk factors that you have for stroke and heart attacks. Unless the aneurysm ruptures and causes bleeding inside the brain, many of the people do not realize that they harbor an aneurysm. Aneurysms, when they rupture, can be devastating. It's a bad disease. 30% of the people who have a ruptured aneurysm usually do not reach the hospital. They end up dying before they reach the hospital. Another 30% die in hospital because of complications related to the aneurysmal bleed, and only about 30% of them survive. And even those 30% tend to have significant deficits when they walk out of the hospital. Now, apart from that, the only time an aneurysm comes to the fore is when they rupture and cause bleeding inside the brain. That is called subarachnoid hemorrhage, or when they're detected incidentally when the patient undergoes a scan for some other reason. Many times people come with headaches, then they undergo an MRI or a CT scan, and then they realize that they have an aneurysm. That may not be the cause for the headache, but sometimes it can be. Not all aneurysms need to be treated. If your aneurysm that you're having is small, less than 2 millimeters, then many times the best option is to wait and watch and see how they evolve. Sometimes they grow, sometimes they may not. So if they don't grow, you may not need to do much. How do patients know that they have a bleed? Whenever the patient or whenever the aneurysm ruptures, the bleeding inside the brain will cause a severe sudden onset of headache that is called as a thunderclap headache. This headache is so severe that it probably is the most severe headache that the person has ever experienced in their lifetime. This many times can be associated with other symptoms like vomiting, drowsiness, seizures, or fits as they call it. Many times the patients become unconscious. They may develop weakness on one side of the body. They may develop neck pain. So many times in very severe bleedings, they can have a sudden cardiac arrest also. The heart may stop beating completely because of the bleeding. So if any of these symptoms suddenly happen, then the patient has to be rushed to a hospital which has a CT scan so that we may know what is the cause of the headache. Once we do the scan and we know that there is subarachnoid hemorrhage, 85% of these subarachnoid hemorrhages tend to harbor an undetected aneurysm. The best investigation that you have to do at this stage will be a CT angiogram or a diagnostic angiography. And once you are certain that an aneurysm is there, then that has to be treated on an emergency basis. Treatment of aneurysms is divided into two things. One, you have to take care of the bleeding that has happened. You also have to take care of the source of the bleeding. The source of the bleeding is the aneurysm. That aneurysm has to be either clipped or it has to be coiled. Clipping is where when you open the brain and you go to the aneurysm and just block it with a small clip from the outside. Coiling is you don't open the brain, you go inside the blood vessel and you pack the aneurysm with small platinum coils that will help completely block it off. There are a lot of advances in the recent treatment of aneurysms where you have devices that can actually completely block the flow into the aneurysm and divert it into normal blood vessels. These are called flow diverters. Then you have intrasaccular devices that sit inside the sac and cause it to completely block off. Once the source of the bleeding is taken care of, then you have to treat the blood itself. The blood by itself will get slowly absorbed back into the circulation over a period of 15 days, 21 days. But during that period that the blood is there are a lot of other problems that can happen. The blood vessel can get irritated and go into a state of spasm, which can cause new strokes. There can be significant retention of water within the brain, which can cause hydrocephalus and headaches. So all these things need to be treated. It's a prolonged disease. It's a prolonged course once you have a subarachnoid hemorrhage, and that may require hospitalization for a couple of weeks to a month. But if treated properly, most of these things can be handled well, and you can save the patient and then prevent further bleedings from happening.